There is a confirmed avian influenza outbreak in South Africa. Izaak Breitenbach from the South African Poultry Association joins me now. Thanks so much for your time on SABC News. So explain to us what is avian influenza and whether we know what led to the current outbreak that we're seeing in South Africa.
Zinga, avian influenza sounds very like it's a scary type of disease for people, but it's not. All that it means is that it's a highly infectious chicken disease that spreads very, very easily. And it also has no cure, so it causes a lot of mortality amongst poultry or all types of birds.
Mm-hmm. It's not the first time we're seeing an outbreak like this. Can you just explain to us what happened the last time there was a large outbreak and the consequences thereof?
I can actually answer that and probably give a bit of insight into what is happening currently. In 2017, we've had an avian influenza outbreak for the first time. And we've learned a lot from this influenza outbreak. We've learned that the disease starts because birds brought the virus from Europe, and the virus infects our own poultry in South Africa. And then secondly, we've learned that the disease normally spreads. And it takes about 3 months for the spread to peak. And then after about 3-4 months, we see a decline in the amount of infections that we record.
Mm-hmm. There have been an estimated 1 million birds that have been killed or culled in this outbreak. Are we going to see those numbers increasing to those around 4.7 million that we saw in 2017?
I'm afraid so, yes. If we learn from the European experience and we learn from the South African experience, we expect the disease to spread. What is different between the two outbreaks of avian influenza are that we've learned a lot from the previous outbreak. Now, the 1 million birds sounds an awful lot to the normal public. But we slaughter 80 million birds every single month. And we've only lost 1 million birds during the first month of this particular outbreak. It'll probably increase to the numbers you've mentioned, is our estimation. What we haven't had in 2017 is that we're actually monitoring about 937 farms. And the moment the farmer sees increased mortality or simply morbidity amongst birds, they ring the bell and we start to isolate those flocks. Mm-hmm. And what then will typically happen is for a 3-kilometer radius around that particular farm that is now suspect, it's not positive yet, we will quarantine all birds, no movement of birds. No birds or product can get into our food supply chain. Then if it's confirmed that it's positive, the product and the birds are disposed of on site. And any other poultry within a 3-kilometer radius can only leave a farm once a vet certified those birds as negative and safe.
All right, so what are the implications for trade and food supply when it comes to this current outbreak?
It does have a lot of implications. I think that the relevant one is the implication of a huge cost to the industry. During the 2017 outbreak, we lost the equivalent of 1.8 billion rands worth of poultry birds. So that is the big effect of this particular disease. We have lost export markets, and we only export about 1 to 2% of total production. So that is not the big effect. I think there's a third effect to keep in mind, and that is the availability of poultry products. As we sit here with the amount of birds affected, we don't see a shortage of either eggs or meat yet in terms of the supply to the food chain. With the increase in the total amount of birds that we will cull, we expect that imports will take up and supply some of that particular product. We hope that with the measures we have this time round, the effect might be slightly lower than what we've expected in 2017.
There's obviously a safety concern when you hear about the number of potential chickens that could be infected. This is food that a lot of South Africans eat. What do we have to know about the safety of chickens? And is there anything that you can do to protect yourself if you're worried about this avian flu making your way to its table?
Firstly, it's not really a human disease. One needs to get a really big infectious dose for the virus to spread from poultry to people. And that doesn't happen in the normal life. I think secondly, no product, once we've isolated a potential positive farm, no product nor chicken is allowed to move off that farm and go into the poultry supply chain. And even if it did, normal cooking processes will actually kill that particular virus. So we don't see a massive threat for people in consuming the product.
All right. Izaak Breitenbach from the South African Poultry Association, thanks so much for your time and insight into that avian influenza outbreak in South Africa.